Hi, can I come in?
Yes.
Hello, my name is Victoria. I'm going to be doing baby Billy's here newborn assessment. Is that okay?
Yes.
All right. How is he doing today?
He's doing good. Sleeping a lot.
Okay. Well, first I'm just going to kind of take a listen to him, get him undressed. He's probably going to cry a little bit. We're going to do a variety of things, and I'll kind of walk you through what I'm doing with him today too.
Okay.
But don't be alarmed if he cries. It's normal. It's kind of what we want to hear. And we'll just get started.
Sounds good.
Okay, so first I'm going to undress him. Try not to make him cry. I want to be able to listen. And I'm going to listen for a full minute. Normal respirations are going to be 30 to 60. A normal pulse will be 100 to 160. And you want to listen to them first because you don't want to startle them with anything else and make them cry, and then you just want to be able to listen. Within the first assessment is normal. If you hear crackles, kind of some fluid, that's normal. His were all clear. We're good to go. So now I'm going to check his temperature. Normal temperature is 97.7 to 99.5, 98.1 for him. Now I'm going to pick him up supporting, I'm going to take the hat off, but I'm going to pick him up supporting the head, and then I'm just going to kind of go around moving in circular motions, checking for the suture lines, checking for the fontanelles. We've got the anterior fontanelle here and then the posterior fontanelle here. And then also just checking for any molding, which molding is common. It's kind of where it overlaps, getting pushed out through the birth canal. Also going to know if I see any caput or the cephalohematoma. Caput, it's kind of going to be, it's where it's extra fluid under the head, so it's going to feel really squishy. Normally goes away on its own. And then the hematoma part, it is where it's on one side of a suture line. It's going to feel a little bit more firm, and then eventually it will go away on its own. But something like that, we just really need to monitor the baby. The baby will be at risk for jaundice. From what I can see in my assessment, that there is no scratching, there's no bruising from birth. It sounded like you had a pretty good birth. Wasn't traumatic, correct?
Correct.
Okay. Now I'm going to check the eyes, from the eyes to the nose, and then I'll check, the nose, and then from the other nose to the eye. That looks normal. You kind of want to split it into thirds, so it's going to be a third, and then another third. I also want to look if there's any discharge. Do the eyes look red? Also want to look for the epicanthal folds in your baby. They are present, so that is good. Moving on, I'm going to take a look at the ears, and I'm going to look on the outer corner of the eye to just the top of the ear, and we'll note that it's just normal. I also will kind of pull the ear back, and we'll let go, and this, your baby does have recoil, which is good. Let's say the ear was hard to recoil, it took longer, then you're gonna typically see that in a preterm infant. Next, what I'm gonna do to your baby is I'm gonna check the patency of the nares. They look good. Now I'm gonna hold just one side. good. Hold the other side. Very good. Now I'm going to take my gloves off. I'm going to re-wash my hands and I'm going to put new gloves on. And then I'm going to take a look at the mouth here. I'm going to check the rooting reflex. So if I'm on this side of the cheek, it's normal for the baby's head to turn towards that side. Now I'm going to insert my finger and just feel the top of his palate to make sure the hard and the soft is coming together and that there's not an opening in there. I'm also, while my finger's in here, going to check the suck reflex, and that is all normal. I'm going to check the baby moved his head, so range of motion is good. And now I'm going to check just in the neck. Do I feel any masses? I do not. Feels good. Now I'm going to check the clavicles. Clavicles are good. This is something we check with all the babies. Some babies can have a very traumatic birth and they can break, so looks normal. Skin color looks nice and pink. Extremities are not blue. That's very good. I'm gonna check the skin turgor. Very good. This is a full-term baby. I don't know any jaundice. I'm gonna blanch the forehead, the chest, blanch the abdomen and the thigh. I'm gonna go back and look at the eyes. I don't know any jaundice here. Next thing I'm gonna look for is the baby in respiratory distress. You can tell by 5 signs. First sign, you'll see some nasal flaring. Another sign could be if your baby has apnea more than 20 seconds. And it's common that you'll see seesaw breathing. So if the chest expands, then the stomach will sink in, and vice versa. If the stomach is expanding, the chest will sink in. You'll also see retraction, and then you'll hear the baby grunting a lot. So next, what I'm going to do is take a look at the abdomen here. I'm going to listen for bowel sounds. Okay. Shape looks normal. It feels soft and tender or non-tender. Looks good. The umbilical cord is still a little wet, but you can tell that it's drying. Keep that area clean. You don't want to clean with alcohol, and it's very important that you don't pick. We just want that to kind of naturally fall off. And then also, when you're changing diaper, you want to make sure when you're putting the diaper on, you want to fold that down so it's not rubbing against and sticking to that diaper. Have you noticed any discharge coming from? Okay, that's good. We don't want any discharge, redness. Just kind of keep a lookout for that. This is a little male baby, so I'm going to take a look at the rugae here. This is full term, so it's deep rugae. I'm also going to put a finger here on the inguinal canal, palpate on the other side, and vice versa. This baby has not been circumcised yet. If you choose to do so, once the baby is circumcised, it's just very important that you don't. It's going to form a natural crust over it, and you don't want to pick that off. You can put A&D ointment over it to prevent that from sticking to the diaper. And then it's also important to note that if you choose to keep the baby, if you don't want them circumcised, or even before that, you don't want to pull that foreskin back. You don't want to force it, just let it naturally go. Now this is a male baby, but if it was a female baby, it would be important to know if there was any discharge coming from the child, the infant, white discharge is normal. And then in a full-term infant, you'll see the labia majora is covering the minora, but then in a preterm infant, you will see where the minora and the clitoris is kind of more pronounced and sticking out. Let me get the baby covered up here. So next we're gonna check recoil. So I'm gonna hold the arm up for a couple seconds, down for a couple seconds, and then let go. And then normally we would see the baby's arms just go right back up. So recoil of arms is present. Next, we would look at the palms of their hands. Has creases, normal. Typically when you see one crease, that is seen in a Down syndrome child. Excuse me. Next we would check that we have 10 fingers, we have 10 toes, none of them are fused together, they're all separate, all intact. Next thing I would do is I would check the Babinski reflex by going in an upside down J, starting at the heel, making my way up, and then that's when the toes would flare. So that is also present. Now, next I would check the spine contour. So I'm gonna flip the baby on his stomach. I'm gonna note that the spine looks even. This is also a chance where you would note any abnormalities, like a tuft of hair or a sunken in spot right above, right in the lower back above the buttocks. This could also be a sign where the spine did not properly close all the way, like spina bifida. Baby is all within normal limits. I would check the behavior. The baby's been fussy, but within normal limits. When's the last time you fed the baby?
Probably half hour ago.
Okay. Could be getting hungry again. Now this next part, it could be a little bit scary to you. The baby will cry, but we are going to startle the baby. I'm going to cut my hands, and then the baby should flail his arms up and make a C shape with his hands. So I can do this by hitting the side, I can do it by clapping. I'm going to choose to clap, and then the baby cries, and then you'll see the C shape in their hands. Fed last was 30 minutes ago. What about stool? When's the last time the baby had a stool?
Probably 2 hours ago.
Okay, 2 hours ago. Just want to make sure that you're checking that often. Sometimes I think it's helpful when moms keep maybe like a journal or just in their notes how many dirty diapers. That is something that even after you get sent home from the hospital and those first pediatric visits, that they'll be asking you. There's plenty of apps on your phone. Get this baby all covered back up. Do my hand hygiene, and is there anything that I can get for you right now?
Nope.
Okay. Well, that is it for my newborn assessment video.